Pneumonia is an infection of the lungs and respiratory system that typically starts with a slight cough. As symptoms persist, a person may develop a high fever and have difficulty breathing. Many people make the mistake of thinking they simply have a cold and do not seek treatment right away. If you are experiencing any of the symptoms on this list, there is a chance that your cold has developed into pneumonia and you need to seek medical attention right away. Here are 7 signals that you may have pneumonia. 1. Persistent cough with mucus. A persistent cough can be a sign of pneumonia. While a cough may be a symptom of a cold or other infection, a persistent cough that does not go away and is quite painful can be a sign of pneumonia. If you have a persistent cough that lasts more than a week, it is a good idea to see your doctor for a chest X-ray and a diagnosis. 2. Chest pain. Chest pain can be very scary and it is not a symptom that you should ever simply ignore. If you start to notice pain in your chest that is more prominent when you are moving around or if you are breathing more heavily, there is a good chance that your minor cold has turned into pneumonia. Chest pain is a sign of pneumonia as well as many other health issues and should never be ignored. 3. Fever. A fever is a sign that your body is fighting off some type of infection. The fever may be mild or may get quite high, depending on the type of infection that you have. A person who has developed pneumonia may start to run a fever as well. If your fever becomes too high, it can cause many other health issues, so it is important to keep your fever under control using over-the-counter medications, cool baths, and other methods to bring it down. You should also seek medical attention right away if your fever goes above 102 degrees Fahrenheit, as these are very dangerous body temperature levels. 4. Chills. Along with experiencing a fever, a person may also develop chills. Getting the chills is common for both pneumonia and the flu. 5. Muscle aches. At times, pneumonia may cause a person to experience muscle aches throughout the body. This goes along with the fact that the body is not getting as much oxygen as it needs to due to labored breathing and the infection that is in the lungs. In fact, you may experience cramping in many areas of the body as your muscles are not being provided with the amount of oxygen that they need in order to function properly. 6. Delirium. If you are running a high fever, there is a chance that you may end up becoming slightly confused or even delirious. If you are starting to struggle with reality and what is going on around you, it could be a sign that you have a serious infection and possibly pneumonia. 7. Diarrhea. Pneumonia can often cause the digestive system to become irritated. When the digestive system is irritated, a person may experience diarrhea. Pneumonia is a health condition that is not related to the digestive tract. However, many people who experience pneumonia report that they often have digestive symptoms such as heartburn, upset stomach, vomiting, nausea, and diarrhea. Remember, make health your greatest wealth. Subscribe for more health-related videos, give the video a thumbs up and share it with your friends.